Yes, thank you very much. Thank you very much for the opportunity to be here, participate here, and present this work. This was work that was presented also last year too, and partly also on the COP28. It was our aim to contribute to the discussion with air pollution and health issues related to fossil fuel use. Initiative was actually taken by Andy Haynes and myself, and he's also here. So thank you, Andy, for your stimulating participation. Actually, this is quite interdisciplinary work. So we have atmospheric, data science, public health, medical sciences. People have to work together to grasp this problem. Technical issue here. Yeah, the atmosphere is sort of like an integrator. So we have emissions, natural emissions, and all kinds of pollution emissions. We call them primary pollutants, but in the atmosphere, actually, a lot happens to them. Many of the gases form particles, and other gases form other gases that are more toxic. So we have transport and chemical reactions. And once this all forms hazes, pollution hazes, things are pretty much mixed. So when you measure air pollution, it's quite difficult to relate that directly to the sources. So that's something we are trying to do. And so we have multiple sources, again, natural sources. This is to a large extent desert dust. Actually, desert dust sounds natural, but it is to a large degree not natural, but it is perhaps unavoidable. And then we have, all kinds of sources, including also agriculture, mobile sources. We heard about traffic. So much of the pollution is actually in the urban environment, and we always focus on vehicles, but actually a lot of the pollution comes from around the cities, also energy production, etc. So it's our task to sort of disentangle this and then relate this to the health impact. Yeah, and this is how it then looks like when it's polluted, and you'll recognize some. It's not always this case. For example, in Delhi during the monsoon, it looks much better. But actually, the particles that are formed in the atmosphere, which are hazardous, are so small that you can't see them with the naked eye. But if you look at them like this, you can see them very well because they scatter sunlight and they also absorb. For example, this orange glow is from absorption of sunlight by nitrogen dioxide. And then we have black carbon. We have all kinds of things in the mixture that absorb sunlight or scatter sunlight. This is the net result of it. And actually, this scattering also contributes to cooling. And this is one concern that we have, that when you take away the cooling, you get warming, which contributes in the other direction. So things are pretty complicated, but here we focus on the health aspect. So let me present you with the central outcome of this study and try to explain to you why the numbers may appear higher than the ones that you've heard before. So the estimate that we are presenting of global excess mortality attributable to air pollution is 8.3 million per year. Now, you need to understand this word excess mortality. It's not that people die from air pollution. People usually die from multiple causes, but this is what is being attributed. So an excess mortality is the mortality that happens in a particular year that would not have happened in the absence of exposure. So it's good to have the definition straight. Then out of this 8.3, which contains also some natural, still 5.1 million per year are related to fossil fuel use, which is actually 82% of what we would call avoidable anthropogenic pollution sources. Now, you could claim that not everything is avoidable, but if you, in principle, everything that's anthropogenic would be classified as avoidable. So this is a very, very large fraction. And these estimates are actually quite higher than most previous studies. And I would like to try to explain this to you. That first of all, we used a new relative risk model that is used to link air pollution to health. And we use a risk model that is based on epidemiological studies that cover the entire range of air pollutants from very low to very high concentration. In the past, this was difficult because we did not have epidemiological cohort studies in highly polluted regions, including China and India, for example, but we do have them now. So we are now able to use these risk models, which are based entirely on studies with air pollution, not proxies. For example, secondhand smoking or indoor air pollution were used as proxies. Then also we account for all-cause mortality, because in many assessments, only disease-specific mortality is being accounted for, and then it's added up. But actually, if you account for all-cause, it's about a third higher than when you just add up the specific ones. And there are quite a number of ones like neurodegenerative diseases and hypertension, for which the evidence is mounting, but they have not been part of this adding up of specific mortality causes. And then, of course, if you reduce air pollution, there's a major reduction in air pollution, and obviously this has a major also health impact or health benefit. Now, why at all can air pollution be so damaging for human health? You should realize that, you know, you're inhaling this the whole day, your whole life. And this is creating chronic diseases. So per day, you take in some 20 to 25,000 breaths, 7 to 8 liters per minute, which is about 11,000 liters per day, which add up to more than 300 million liters in a lifetime. And the very small particles and the gases can get very deep into your lungs and even get into the bloodstream. Then health impacts include short-term ones, like when the air pollution is very high, you will be coughing or have difficulty breathing or aggravating asthma or have eye irritation, etc. But what we are most concerned about is the long-term impact, because the chronic exposure causes chronic diseases. It causes oxidative stress in your lungs and systemic. So we have pulmonary and systemic inflammations, vascular dysfunction, atherogenesis, which is basically plaque formation in your arteries, impaired metabolism, and health outcomes are ischemic heart disease, from which you can get heart attacks, strokes, cerebrovascular disease, respiratory tract infections, chronic obstructive pulmonary disease, asthma, lung cancer, type 2 diabetes. There's overwhelming evidence that these diseases are either caused or aggravated by air pollution. And there are a number of others that are implicated, for which the evidence is growing, like decreased birth weight, premature birth, arterial hypertension, and neurodegenerative disease. A central aspect of epidemiological studies is the hazard ratio, and you can see that here, and you see these solid lines and the dashed line. And the solid lines are from epidemiological cohort studies that actually use these proxies. So the good news maybe is that these lines are a bit lower. Let me first explain you what the hazard ratio is. So if you look at the dotted line, you see that when you are exposed on average to 40 microgram per cubic meter PM2.5, which are particles with a diameter smaller than 2.5 micrometers, then you have a 50% higher chance of developing heart disease from which you die. And this goes per age category. Now, these solid lines use proxies, and the dashed lines, they use air pollution data only. Now, maybe the bad news is that these lines are higher, but the good news is actually that they are more linear. So that actually means, and that's important for policymakers, that whatever measure you take, even if you're at high or at lower levels, it always leads to improvements in air quality and improvements in health. Whereas in these lines where they're almost flat, so you have to decrease the air pollution very strongly to get an effect. And then we use these hazard ratios, and then it's a simple concept actually. We have excess mortality, we use baseline mortalities, we need population numbers, and then we calculate based on this hazard ratio or relative risk what we call attributable fraction. So this is a statistical exercise. And sometimes you hear, okay, these are only estimates, but I can tell you these are estimates based on large numbers. So they're estimates, they have uncertainties, definitely, but they're not just estimates in the sense of that you can ignore them. They are solid evidence of health problems. And then if we do that, we can make these maps. And you can see, for example, that in South and East Asia, things are quite bad. Actually, you can, if you look at the numbers at the bottom, you can see that this is not linear. So the light orange ones are like a factor of 10,000 lower than the darker purple ones. Actually, these numbers are a combination of bad air and high density of population. So we're now not looking at air pollution, we're looking at air pollution impacts on people. So, but the South and East Asia is where about 55% of our population lives, but about 70% of this mortality occurs in this region. But we also see other regions, like in West Africa and Eastern Europe and some other regions, which are quite bad. And again, this 8.3 million per year is given here, but also the mean loss of life expectancy, 2.2 years. And then we use our tools to attribute. So, and what we have done here also is we have these results for each country in the world. So if you're interested, you can contact me. I can send you this information. So excess mortality rates are per population number, per 100,000. That's a fairer way of showing it, because otherwise, in the previous diagram, we had also population density sort of indicating that things are very bad in certain places. But this is normalized to population. So now you see the places where actually excess mortality is high as a percentage of the population. And you can again see South and East Asia, but also Western Europe and some other parts of the world. Then if we take out the fossil fuels, you see that there are huge differences. So this actually goes down tremendously. And especially also in East Asia, but also South Asia, in Europe, also North America, Middle America, South America. And some parts of Africa less, especially directly in the vicinity, also in the Middle East of desert. As I indicated, some of the desert dust is not natural, but it's probably unavoidable. Then if we look at the disease categories, you can't read this, but what I can say is that things that affect children are brownish here, and things that affect chronic diseases, for example, ischemic heart disease, COPD, and stroke, are more like bluish. And what you can see, the upper three ones or so are to the left are North America, Germany, and the right one is China, that actually cardiovascular diseases are way more than half of the cause of this excess mortality related to air pollution. But if you look in, for example, Pakistan or Central or Western Africa, you see that a lot of children suffer. And this is mostly because of pneumonia. Many children still die from pneumonia, and this is very much influenced by air pollution. And pneumonia is a treatable disease with antibiotics, but still many children die as a result. So it's something that maybe not so well known, but many children. And of course, this has a big impact on the life expectancy. And this is what you see here. This is the life expectancy loss from several causes. In the upper left, you see air pollution for different countries, which is contrasted to the upper right with tobacco smoking. Lower left is diseases such as malaria, and to the right, lower panel is HIV/AIDS. And you can see that ambient air pollution is on par with tobacco smoking in terms of total premature mortality. To summarize, the estimate of global ambient air pollution mortality is 8.3, 5.1 related to fossil fuel use. Actually, air pollution is among the leading environmental risk, but one of the top 5 overall, like with hypertension, etc., tobacco smoking. The global mean loss of life expectancy is 2.2 years, but in some countries like India, Pakistan, Central Africa, and some others, it's more than 3 years. And this is, as I said, on par with tobacco smoking. And the final conclusion should be that phasing out fossil fuels is a really effective intervention to improve health and save lives as part of the United Nations goal of climate neutrality by 2050. Thank you.